All right, welcome to another episode of Medicine Mondays. Yours truly, Dr. Pierre. This week, we're going to be talking about an important topic that can cause a little divide. And I know in the office, a little divide is kind of the last thing you want, right? You want a kumbaya type situation. But in the climate that we're in right now, depending on when you're listening or watching this, I think it's so important to have one of the leaders in your community, which if you don't know who that is, as a physician, you are typically a leader in that community. And I'm not saying that you run stuff. I'm not saying all of that. Doctors have always been one of the higher evaluated and sought after and just looked upon career fields. So when you're in a community, if you're a physician in that community, especially if you're active or not really active in that community, you have people who tend to look up towards you. And when you have people and you're in that position where people are looking up towards you for your expertise or just to hear what you have to say, to be able to say, hey, you know what? I'm a physician, I do what I do, but when it comes to politics, that's not really my bag, or I don't want to talk about it, or that has nothing to do with me. That's the worst one. When I hear doctors say, all right, politics, I'm not getting into politics, that really doesn't affect me, just blows my mind, because a lot of the angst around medicine and just healthcare in general is typically politically centered in regards to seeing a lot more patients, getting paid a lot less, paperwork and insurance. That's all politics at hand. So when I hear physicians try to placate as if they don't need to be aware of the political climate and be aware of politics, and more importantly, how it can affect your patients at hand, I give a side eye. Now, if you've been following me for as long as you've been following me on social media, you kind of understand that there's typically no topics that I run away from, especially when I know it affects my patient. And you best believe politics has always been one. Politics has always been one that I know that I have to be aware of, because I know that decisions that are made in, your state's capital, in the United States Capitol, like decisions that are made outside of my walls can directly affect the patients I'm taking care of in front of me. I don't act like that's not the case outside of some of my colleagues. So I think, especially as we're gearing up, elections, especially depending on when you're watching this, if you're watching this as fairly recent, or when I, recently drop it, elections are coming around, elections for the president, elections for senator. If you're a local community, there's probably commissioners and mayors. There's a lot of people being elected. And as a healthcare provider in the community, I have to be aware of what they're saying, what they're not saying, because I know that it can have a direct harmful effect to the patients I'm taking care of. So it's not a topic that I'm scared of. We're going to talk today about why I think it is important for your doctors to talk politics, whether it be just in general amongst their colleagues, but more importantly, maybe amongst their patients. I think it's important to have that conversation. I understand why some people don't, and we'll talk about that. But I understand that because I know there are issues that occur, that changes and, laws being passed that I know that can have such significant harm to my patients. It's almost my right as a community leader, which again, all healthcare providers, especially my doctors, all doctors are community leaders, regardless if they try to run away from the title or not. And I don't care if you're in a community where there's 1,000 doctors and you throw a rock and you hit another doctor's office, you are a community leader. And for what your position is, you can have a lot of sway. Let's talk about first the elephant in the room. Why don't doctors like talking about politics? Like, what is it about politics that seems to scare just people in general, but especially doctors? Number one, in school, we aren't really trained to be in situations where it may be adversarial, meaning that, hey, someone may have a different opinion than me. Given it, for example, think about the doctors who don't like patients who Google their disease process and call them like Dr. Google. Like, think about those doctors who have trouble, and you know me, that's something I champion on this channel all the time. Think about the doctors who hate the patients who go look up their disease process information, go find, some treatment options, treatment remedies, and then bring it back to the doctor, and then have a spirited discussion on like, doc, I hear what you're recommending, but I read this book or I read this website that I want to try this here. Think about that. So if you know that there are doctors who have trouble just having those conversations. You best believe when you start having conversations kind of centered around politics and depending on where you lie, you best believe this is why doctors tend to shy away. Like, nah, I don't want no parts of that. Now, mind you, I'm in plenty of doctors' lounges across the country and everything. They don't shy talking politics amongst the doctors' lounge. In the doctor's lounge, it becomes very clear what side you lie on. But when it comes to their patients, they don't want to be in a situation where there may be some argumentative hostilities brewing, right? They're just here to tell you, hey, take your blood pressure medication, or hey, I got to take your gallbladder out. They don't want to know, like, hey, what do you think about women? Like, that's not something that they are here for. Or more importantly, that's not something they're trained for. Because I believe if medical schools trained you for it, right? If medical schools said, hey, you know what? We need you guys to be a little bit more politically involved and understand how the politics around you can have direct and indirect effects on the patients you have to take care of. I'm pretty sure you'd have a new school of doctors who are okay doing that. But I can tell you right now, it's just not the case at the moment. So you have this instance where, you know what? I don't really want to be contentious, right? I don't want to be in a contentious situation. As a community leader, you may not know everything, right? You may be the best pediatrician, neurologist. You may be the best of that, but you may actually suck at politics, because politics is something that you have to take an active approach on trying to learn. You got to take an active approach on it. So imagine, again, you got this doctor who's kind of full of themselves and they think they know everything, and you try to put them in a scenario where they don't know everything. They're running away from that, right? Like, I tell myself, put me, right? I'm an internist. Throw me in a hospital, I'm good. Throw me in Home Depot and tell me to go buy some stuff to build, like, nah, my head is spinning. I kind of know my limits. And for a lot of people, especially healthcare providers, especially community leaders, politics, they don't spend enough time focusing on learning what they need to know. More importantly, learning what they need to know that actually communicate towards your patients, right? So there's this feeling of, I don't know enough. There's this feeling of, all right, I don't want to ruffle any feathers. And because of those feelings there, they're like, you know what, I'm going to stay away from the politics. But I think it's a bad idea. I really do. I think it's a bad idea because I know how important it is to attach politics in healthcare. It's very easy, right? There are a lot of different examples that we can say, hey, the politics played a part in expansion of Medicaid. The politics played a part in getting the Affordable Care Act. The politics played a part in vaccine mandates. The politics played a part in making it so that they started covering routine screenings and mammograms and colonoscopies. These are politician-related issues that, again, directly affected your patients. So to sit here and act like there's no connection is wrong, right? And I always give the flip side, and I kind of mentioned in the introduction. A lot of doctors who are screaming burnout right now have politics to blame, right? When politics and people in, C-suites around who are making decisions say, hey, you know what? I don't think this internist should make this much for this procedure. All right, we're not gonna pay for that. I don't think this surgeon should make this much for this surgery. We're not gonna pay for that. I don't think we should pay the hospital this much money for that, long hospital course. We're gonna pay less for that, right? These are politicians who are behind closed doors making decisions. Sometimes they're influenced, and we can have a whole conversation on the influencing of the decision makers, right? In fact, it's so funny. I was on my Twitter, I believe. I posted on my Twitter that my yearly Medicare reimbursements from like insurance companies, right? Because a lot of times people have been confusing me or accusing me of being in bed with Big Pharma for a while. So thankfully, Medicare does a great job that they will publicly put your business out. They will say, hey, we will keep track of all of these doctors making all of this money being paid by pharmaceutical companies. We'll keep track of that. We'll put it on the website. In fact, if you just Google Dr. Barry Pierre Medicare compensation, you'll find out how much I've made over these past, I think it goes back to like 4 or 5 years. It's actually been a while. You could Google to see how much insurance companies have paid me to sponsor talks, to speeches, to do these things here. And I got a whopping, I think it was $23 last year because I attended somebody's lunch. I don't even remember the drug company's name, but I attended their lunch, and I guess the lunch that I ate was worth $23. So of course they had to keep track of that, right? So this is information is out there. So I understand that there is decisions that are made that are influenced by outside forces, but at the end of the day, as a physician, you got to be able to talk to your patient, talk to your colleagues, talk to your family, and say, hey, this is what's going down. You have politicians who are against the Affordable Care Act. We've talked about this, right? You have politicians who are against preventative care. You have politicians who are against women's choice, right? Which means they're against abortion and things. You have politicians who are against that. And guess what happens if you are a physician who is in position to take care of those patients? You can't act apolitical. I don't care what you say. You can't act like it doesn't matter that politician A is running on a platform that's directly going to affect 50% of your patients. Like, let's stop it. I think a lot of times physicians kind of get ahead of themselves and they try to hide behind this, oh, I didn't know, oh, it's politics, I'm trying to stay out of it. No. You're not staying out of it. Because like I said, they go crazy in the doctor's lounge. They're confident in the doctor's lounge. They're active, they're vocal in the doctor's lounge, but when it comes to their patients, they're like silent as a church mouse. And we can't have that. We can't have the physician who isn't going to help their patients make the best decision. Now, I'm not telling you like to try to convert your patients to your way of thinking, because everyone has their way of thinking. I'm big on sales, right? For those who may not know, I'm big on sales. I'm like a marketing geek in that sense per se. I read a lot of sales books. I listen to a lot of sales books. I go to conferences focused on sales. And the reason why, because as a physician, I feel like I have to be one of the best salesmen. I feel like I have to be able to convince someone who doesn't know me to trust me to follow my direction. AKA, I'm your new doctor. You're new in town, or you just changed doctors and you got this problem, blood pressure, diabetes, high cholesterol. And I have to sell you on the fact that I'm going to be the person to help manage these disease process with you. So if I don't do a good enough job selling that, that's why I go to these types of conferences. I don't do a good enough job selling that, I'm going to be in trouble. So I understand that when it comes to politics and just people in general, there are going to be some things that say, hey, you know what? As long as politician A checks this box off, I'm not really paying attention to, all the other things they do. I understand that. It is what it is, right? But as a physician, as a community leader, I have to make sure that you are aware of every side, consequence that occurs if you make a decision one way or the other. It's so funny. I remember, especially when Affordable Care just came into fruition, and then there was a lot of opposition trying to get it repealed quickly. Like they were trying to get it out of here like quickly, which is so wild. And I used to have patients who would ask me like, hey, what do you think about them trying to appeal, this, and that? And I would have to tell them, say, hey, let me tell you something. Let me look at your chart real quick. You have diabetes, hypertension, high cholesterol, a history of cancer. Let me tell you, if not for the Affordable Care Act, this insurance company is not likely going to insure you. This Blue Cross, this Humana is likely going to say, I'm not going to take you on as a patient. So then you're wandering out on the streets with your high blood pressure, your diabetes, your high cholesterol, all these things uncontrolled. And then you have to end up in the ER because you had a stroke, you had a heart attack, right? Because you weren't controlling things that you could have controlled because you got a chance to see a person like me. And that's just one of the things that Affordable Care Act did, right? So understand that when people are saying, hey, I want to repeal the Affordable Care Act, what they're saying is, I want to make it so that you yourself cannot be on insurance. And now you have to either hope that you are living the rest of your life healthy, or you got to pay out of pocket. What do you think about that? And I always put the ball back in their court, but I have to educate them while doing it, right? I don't have to persuade them from a political perspective. I just have to say, hey, this is how this political decision can affect, what me and you got going on right here. And it's a conversation that I have with my patients all the time. I run at multiple places. One of the most common channels I see is Fox News. And I'm in South Florida, right? So it makes sense. Fox News. And I understand that Fox News has an agenda. Fox News, has, political affiliation one way or the other. And the people who are on there may have decision-making ideas that may negatively affect, the patient I'm taking care of right now, right? So I understand that, hey, you know what? This may be a contentious conversation, but I understand this is a conversation I gotta have. And most of my patients, because, I'm a good salesman, I guess. I do a good enough job earning their trust. They got no problem saying, hey, doc, what do you think about that? And I have to be ready. Again, I don't think I have the luxury to say, I don't want to talk about politics. I can't do that, right? I have to be able to say, oh, well, this is what this person wants to do. This is why this person wants to do it. And I always make sure to say, and this is how it can affect you. I always have to say, this is how it can affect you. Because a lot of times, if we don't realize like how it affects us at our doorstep, we'll act like it's not a very big issue at hand. So that's why I'm big on being confident in talking about it and understanding the importance of talking about it, because I know, and there's so much history to show that it can affect the patients I'm taking care of right now for decades to come. I'm so thankful that we were able to kind of pass the Affordable Care Act plan, because I know that there's patients who are alive today because of that. Like, I just know it. It's like, I don't need to embellish it or hyperbolize it. Like, I know for a fact there are people who are alive today because of the Affordable Care Act plan. And so I have to be able to really educate my patients in saying, hey, this is why I'm rocking with this candidate or another, right? I take care of a lot of patients. I can take care of a lot of women. I have to let them know, hey, this is why I'm rocking with one patient or other, right? Because me personally, I am pro women's choice. Like, I want y'all guys to choose. I don't want a politician who has no history in medicine and background to make decisions on you. I don't want that to occur. I want it to be between you and the physician expert who should be making that decision, right? So, of course, there's going to be certain people, if you lean one way, I'm not rocking with that, right? Because that's not going to be good for the benefit of the patient I am taking care of. Now, trust me, and this may sound wild, there's some physicians out here that even though they may take care of obstetrics and they take care of women who are pregnant, they may be saying, hey, you know what? Women's choice? I don't know about all that, right? Leave it up to the states, right? There are doctors like that. It sounds weird to me, but I know it's not weird because, again, they may have some other dominoes that need to fall. And for them, if this big domino falls, everything else, it just is what it is. I understand that. But I understand that that's a wild position to be in, especially in the patient population you're taking care of. But it's not shocking or surprising to see that people are in that ilk. Not shocking or surprised to see at all. So I think it's important, especially you as a patient. Y'all know typically I'm talking to my patients when I'm doing my episodes. So y'all know typically I'm talking to y'all, I'm trying to educate y'all. I always try, let me see if I flip the script, right? Let me see if I put it on the doctor's side. What could the doctor be thinking, right? Especially at a time like this where politics are on your TV every day, every other day, depending on what you watch. Unless you like tuned out and you don't do TV and you don't do social media, which is wild because how would you be watching or listening to me? But that's a whole different discussion. If that's the case, then I can understand why you may be a little bit disconnected. But understand that there are going to be decisions made this upcoming elections that are definitely going to have direct correlation on you. And if you can't go to your doctor and talk to your doctor about, hey, the decisions that I hear they keep talking about on this TV channel, is there a way that it can affect me personally? Because again, I think we all move a little different when something can affect us personally. If you can't go to your doctor and say, hey, these decisions that are being made right now, is there a way that it can affect me personally? I think that's how you should ask it to. And the doctor can't do it. I don't want to talk about politics. They want to do one of those things there. You just got to shake your head at them, right? With a little bit of disappointment. I would, right? Because like I said, it's not that your doctor doesn't like talking politics. They just don't like talking politics with you, right? They just don't feel that you are someone that they could talk politics with, maybe because they're afraid that you might leave their office, which is, I think it's a real fear for them, right? They maybe, well, if I tell them my political aspirations or political ideologies, they won't like see me as a good doctor anymore. That may be the case, right? You're talking to a person who has taken care of patients. They're a little senile, right? The, little frontal lobal dementia, right? So that part of the brain that would tell them not to say those words, be cognizant of who you're talking around, because that person may hear, it kind of diminishes. And if you've ever worked in like nursing homes and places like that where, a little dementia is kicked in and they're just saying all types of words, and I think you're kind of getting my drift on the types of words that they're saying, you understand, like there's a lot of patients out here, right? There's a lot of patients out here. So you can't run from it, right? And you must not run from it. But guess what? As a physician, you still got to take care of that patient. Like you may still have to be like, all right, I'm going to just chalk this up to dementia. You still got a gallbladder that needs to come out. What are we going to do? You still got to take care of the patient despite that, hey, you know what? This buddy-buddy relationship may not be the thing, but I'm going to just keep it professional, right? And that's what doctors like to do. I want to keep it professional because I'm fearful that if I talk politics, it may bleed into it and causes rifts and struggles that I don't want to have to deal with, which again, I think is, not a good decision, but it is a decision that I understand that doctors have to make. So we're going to end this episode, but again, I want to make sure we frame the conversation appropriately, right? Like how can doctors start talking to their patients about politics and why is it so important? One, I think it's obvious because it could be life or death. Like let's start and stop right there. It could be life or death, the decisions that are made in political offices around the country that can hit your front doorstep right now, right? So it can be a life or death situation if the decision-making process or just a discussion, right? And again, I don't want to say decisions because I don't want people to think like I'm trying to get patients to sway votes and stuff. No, that's not the case. But if the decision-making process doesn't have some type of discussion where you say, hey, you know what? These are the pros, these are the cons. I'd rather you're expert in healthcare and you're expert in understanding how this change from a political standpoint can affect you from a personal standpoint. I'd rather that person be a doctor, right? I'll be honest, right? I'm selfish. I'd rather be us having that conversation. I think if you're a physician listening to this, or the healthcare provider in general listening to this, understand that the onus has to be on us to be educated, right? Again, I'm not asking you to learn about every single bit of platform that a candidate may have, but I am asking you to figure out from a healthcare perspective, because guess what? This is the field we're in. From a healthcare perspective, how does this help me? From a healthcare perspective, how does this hurt me? From a healthcare perspective, how does it help my patient? From a healthcare perspective, how does it hurt my patient? Like, you should know that. Like, if you don't know anything else, you should know that. Like I said, some of my patients, right, who I take care of, right, who I know are on the opposite side of me, right, and we're the best of friends, right, because we argue, right, but we have good spirited conversations because they understand that at the end of the day, I'm trying to figure out how can I help you best. And if I don't think this person on that TV right there is going to help you best, I'm going to say, hey, that person right there ain't going to help you. They may help you, from a tax perspective. They may help you get a little tax cut on your real estate. They may help you on that religious tip. They may help you on that. But when it comes to this, what we're taking care of right now in this office, in this hospital, in this clinic, in this healthcare building, they don't help you there. Right? Just so you're aware, right? Just so you're not bamboozled and trying to figure out why your Medicare benefits are lower or why you all of a sudden can't get certain prescriptions with your secondary from your insurance, right? Like when that happens, I don't want it to hit you and you'd be like, oh my God, I didn't know that this was going to be like, you kind of knew because I told you, right? You kind of knew because I told you like that party over there doesn't really like Medicare and try to get rid of Medicare or doesn't really like vaccines and trying to get rid of vaccines or doesn't really like preventative, measures and they're trying to get rid of it and they're trying not to pay for it or they're trying to make you pay for it, right? Like I'm gonna let you know that that is the case going on because as a healthcare provider, but more importantly, as a community leader that I am, I think it's my right. So I'm yours truly, Dr. Barry Pierre. I think we are going to have a lot more discussions kind of focused on this. I'm going to try to see if we can get some guests on here, especially in the political realm, to kind of, give us a little background on what's going on because I think it's important, especially for patients to be aware. Because remember, we talk about this Empower Yourself for Better Health. It happens in all facets of life, especially in this time where we're talking about politics. So y'all be blessed, and I'm see you guys next week.